Hey, it's me, Jen again, and today so many patients are seeking to treat their health concerns with a more holistic approach. Today I'm speaking with an integrative endocrinologist who is helping her patients achieve metabolic wellness through an individualized approach, and now she's helping preserve their thyroids through RFA. More on that after this. If you value this content, please subscribe to this channel because that really helps YouTube to put these videos in front of more people. And that helps more people be able to save their thyroid from surgery through radiofrequency ablation, a treatment that shrinks thyroid nodules directly and preserves the thyroid gland itself. Today, I'm speaking with a doctor whose unique expertise are highly sought after by patients today. Dr. Angela Mazza is not only an internal medicine physician, but also an integrative endocrinologist who seeks to treat the whole person and not just a diagnosis. I actually stumbled across Dr. Mazza's website myself when I was looking for a functional medicine practitioner a few years ago. Let's hear more from Dr. Mazza about her very unique endocrinology practice in Oviedo, Florida. So tell me more about your medical background. How did you get into what you're doing right now, and tell the viewers a bit about what you're doing now in your practice?
I'm an integrative endocrinologist. So what does that mean? It means I went through traditional training, so I'm board certified in internal medicine and endocrinology. In my fellowship is when I started doing ultrasound guided FNA biopsies of thyroid nodules and kind of started my career in thyroid nodules, if you will. I've always had an interest in whole body wellness. So throughout my journey, I've done some additional training in functional medicine. So functional medicine is more like kind of regenerative and whole body medicine. In this practice, I incorporate the two together. So they essentially are integrative medicine. So I really take care of a lot of people with thyroid nodules as well as hormone balance because hormones are so important. They don't exist in a vacuum, especially thyroid hormone. And thyroid hormone is so very, very important for so many things. Anything metabolism related. So you got cholesterol metabolism, energy metabolism, your receptors on our heart, on our gut. So it's so very important, which kind of circles back to the whole care of nodules, where if we can save the thyroid itself and take care of nodules in a non-surgical extreme way, we can help preserve that thyroid function. So that's kind of what we do here at my practice. So
well, that is super cool. I think I've only talked to one other doctor who's in endocrinology, who's more integrative and functionally minded. And it is so cool to see that doctors are taking on that perspective because so many patients are looking for doctors like that.
Yeah, and I think our patients deserve it because it impacts every quality of their life and every aspect of their life. Because, if you just pluck out a gland, it's going to affect everything else. It's quality of life.
Absolutely. That is the whole motivation behind my advocacy, is the fact that, my quality of life was spared by having this procedure because I did not have I had this gut feeling that surgery was just the wrong thing for me personally. And I had a bad surgical experience when I was 18, and I'm still suffering consequences from that. And I just thought, I don't want to go there. So RFA was quite a game changer for me. So that's why I'm doing all these interviews and this advocacy, because I know there's other people out there who are looking for that same answer to preserving their thyroid and their quality of life. So it's really awesome when doctors say that that's important to them too, because so many patients are like, my doctor just does not care. My doctor's just like, oh, we'll just take your thyroid out and give you a little pill and you'll be fine.
No, and can't tell you how many people I've taken care of after the fact they've had surgery. And I have to say, I respect and value our surgical colleagues so much, but we get the other end of it after people have had their surgery. And getting that right thyroid hormone balance is not an easy thing to do. You can have the best thyroid hormone replacement, the best, most expensive thyroid medicine, and it's just not always right. It's balancing clinical symptomatology as well as with labs. So it is a challenge, which is why I think it's so great that you're building awareness of this for our patients, and so patients can be advocates for themselves and educate their doctors too, because we're trying to educate doctors, but it's still so new.
Yeah, we're getting there. We're getting there.
Yeah.
Well, how did you learn about this procedure? What
What brought RFA to your attention?
Well, about 7 or 8 years ago, it started coming on the radar in publications from other parts of the countries, or other world rather. So
Mhm.
Korea, Italy, even the UK. Once ACE, which ACE is American Association of Clinical Endocrinologists, started bringing it up in their guidelines in 2016 as RFA as a option for thyroid nodules, I was like, well, it's not going to be too long from now. The FDA is
Mhm.
going to approve it, and I'm totally on board. So it's been a process because up until that point, as far as just procedures for nodules, we had PEI, which is percutaneous ethanol injection,
Right.
which is basically just injecting super dehydrated alcohol into nodules. And that's great for certain nodules. It's really good for cysts. This doesn't work really well for a lot of other nodules. And
Mhm.
it can have complications too. So RFA is kind of like the best of both worlds.
So once you discovered it, how did you like prepare to do this in your practice?
Well, first, since we are an independent practice, I had to start looking at logistics as far as finances. That's one thing.
Yes.
And that's one of the great things about having an independent practice is with institutions, there's a lot of hierarchy and red tape, which
Mhm.
makes it a little bit more challenging. I attended a hands-on cadaver session, so that was interesting. I hadn't seen or worked with a cadaver since med school, and I was like, and another endocrinologist who has been doing RFA in her practice for a little while now, kindly had me in her office and gave me some mentoring through that way. So, and I
Mhm.
still keep in contact with other endocrinologists that do it. So it is kind of like a little bit of networking and
Mhm.
support.
Once you did the training, when were you able to bring this into your practice? Like how long have you been offering it?
We're just going on a year now. So, and
Awesome.
we've had great response.
Yeah.
It's rewarding for the patient, but it's rewarding for me too. So I feel like it's a win-win.
What are your patients' experiences like? Are they generally pretty happy with their results?
They are really happy. I mean,
Yeah.
because a lot of them, just from doing research on the internet and your Facebook posts and YouTubes, they actually do have they've been looking into it and thinking about it for a little while already. So I
Yeah.
feel like they're kind of in that mindset where this is the
Mhm.
route I want to go. And most of them pre-procedure are having symptoms, whether it's just the nodules just annoying them, they don't like the way it looks, or it's causing compressive symptoms, or having difficulty swallowing, or voice changes, or even when they're sleeping, they feel it pressing. Those are the types of symptoms that even right shortly after the procedure, they start noticing an improvement, and it
Mhm.
continues to improve. So it's been very, very rewarding, I think, on both ends.
What about experience with insurance? Have you known any insurances to cover in your practice?
Not outright, not to say that down the road insurance won't cover it. What we do is give patients a letter of an appeal where that they can
Hmm.
submit. Some people have had some success in getting money back. So at least it's something
Hmm.
rather than nothing at all. And the way
Yeah.
I look at it too is nowadays people have such high deductibles. Even if you go for surgery, you're going to be unfortunately left with quite a bill too.
Right.
I think once the insurance companies put X and Y together, that they're actually saving money by going this route. So, I mean, a hospital, like if you have your total thyroid taken out, that can be up to $50,000. I mean, it's insane. And
And
I
then the lifetime of meds to add on to
like
that cost.
meds and then constant lab monitoring, and
Yeah.
it adds up. So I think once the insurance companies get kind of those numbers together, they'll be able to say, maybe this is worthwhile for covering. I
Yeah,
think
and
I think it's a matter of time, really, like with
I
anything.
agree. We've had several people who've been successful with having theirs covered. Predominantly, they're the ones who have like the really bad symptoms,
Ah,
compression and whatnot. Some of them have had to really, appeal and fight. A lot of times when they decline it right away, I think there's this idea of, well, the patient's not going to fight for this. And when the patient comes back and says, no, you should cover this, I need this, they're successful in appealing. So that's really encouraging.
yeah, I mean, unfortunately, there's some barriers that are put up on the insurance side. So being a little
Yeah.
persistent, the squeaky wheel,
Yeah,
sometimes
exactly.
it
The
does work.
squeaky wheel gets the grease. Yeah. You already were telling me you feel like this is such a great procedure for people who want to just maintain their quality of life. When you're dealing with a patient who's already had a thyroidectomy, what kind of consequences are they suffering from that the RFA patients are not dealing with that maybe not directly thyroid related? Are you aware of anything like that?
Well, that's a great question because, I mean, with surgery, again, even with the best surgeons, there can be complications. So do have a handful of patients that post thyroidectomy have had just permanent hypocalcemia because their parathyroids have been affected. That's a game changer for people as far as quality of life. I have a couple people that went on disability because of the severe effects of hypocalcemia.
Oh my
And they have
goodness.
to be on other medicine to help keep their calcium up in addition to just calcium. Whereas people who go through RFA, that doesn't happen. I have some people that have had permanent voice changing. That doesn't happen with RFA. One of the minor complications of RFA can be some temporary hoarseness in like 1% of the patients, but again, it's temporary. Whereas people who have had these complications with surgery, that's lifelong. It doesn't go away. In addition to just the thyroid hormone replacement that we were talking about and maintaining levels. And it's not just a point in time with surgery. It's a long thing.
That's
Whereas with RFA, they don't have that issue.
One of the statistics that I read about thyroidectomy is that the average weight gain after thyroidectomy is 20 to 30 pounds. Even with their thyroid medication being regulated, for my personal situation, that was a non-starter. Those surgeries I mentioned when I was 18, they were 2 knee surgeries back to back that had severe complications. So I have this totally destroyed knee joint. I'm 38 and I have handicap parking and only 90-degree range of motion. To gain 20 to 30 pounds would have been tremendously harmful for me personally. And so I just think about things like that for people who, when they have the surgery, they're just maybe thinking about, well, I need relief from these symptoms. I don't want this thing in my body anymore. What if it turns into cancer? And they have these fears. And that's all very short-term thinking rather than long-term of how am I going to be able to maintain my weight, my metabolism. I've heard people express that they have issues with their gallbladder after thyroid removal, all of these other things that don't seem connected directly to the thyroid, but thyroid patients who have thyroidectomy suffer a lot from these different things. And that's not something that we have to deal with RFA.
Exactly, because the thyroid function is essentially preserved. I mean, if we're maintaining all the important things that the thyroid does, like you mentioned gallbladder. People don't think about gallbladder, but gallbladder is affected by thyroid hormone effects on the gut and hormones that come from the gut. So thyroid in turn affects hormones that affect how the gallbladder empties. So it's important to think long term, like you said, rather than short term.
Well, it's so great to hear that from a physician's perspective. I've heard another RFA provider say the same thing, thinking about the long term. I forget exactly what it was that he mentioned, but it was generally the same conversation where he was saying, yeah, like these patients are just thinking, let's just get this out of my body.
I don't want to think about it anymore.
Yeah. And particularly with cancer, thyroid cancer for the most part is not something that's going to kill you. But there's so much fear associated with that.
C word, right?
Yeah, because it's like, well, it's cancer, and they think about their family member who maybe had colon cancer or lung cancer or something that's much more deadly. And in our Facebook group, we have a lot of women because predominantly women are impacted by thyroid nodules the most. A lot of them are young and they have children and they're saying, I have 2 small kids. I gotta be here for my kids.
Right.
Please tell me I'm not going to die from this. And of course, we can't predict the future, but it's so reassuring to give them statistics on 90 to 95% of nodules are benign. Most thyroid cancers are not fatal. And I believe, based on the conversations that I've been having with physicians and the webinars that I've been seeing offered recently, I believe that that's the next thing that's coming with RFA is treatment of certain thyroid cancers.
I agree. It's right down the line, and it's right on the cusp of happening. So that's why I'm excited to be on board at this point in time before it happens, because I want to be able to offer that to my patients.
So yeah, I think RFA is going to really change medicine in this, endocrinology, ENT space, as more patients can access this and save their thyroid. I hope to see the statistics change on how many thyroidectomies are happening in a year.
It would be nice to see. I mean, and there's still a space for certain people that need surgery, but not all of them.
Is there any words of encouragement or wisdom that you would like to pass on either to patients or other physicians? What would you say would be your elevator pitch about this?
Well, I think the future of medicine, no doubt, is personalized medicine. And it's not a one-size-fits-all, but RFA kind of gives that additional option and therapy that allows us to really target a nodule rather than just doing a shotgun approach and just taking it out. Because then we're left with trying to recreate what our body was doing on its own, which is it's a challenge in and of itself. So I'd say RFA is the future for most nodules and for potentially thyroid cancer. So, and I'm glad to be a part of it. So
yeah, I think it fits really well with what your mission is as a physician, you know, to this integrative approach to endocrinology. That's such an interesting fact about you that's very unique, and I hope that it becomes more common to see this type of option available for patients. And do you have any last minute little interesting facts about you or your practice?
We're a small practice, so we kind of we get that extra personalized care here. My husband is our office manager, so he kind of
cool.
he's our gateway for the RFA patients who come in. So they get to talk to him, and he gives them kind of a little bit of inside scoop.
How can patients find you online if they want to learn more about you or if they want to make an appointment with you?
We have our website. It's metaboliccenterforwellness.com. We also have a Facebook page, Metabolic Center for Wellness. We'll be happy to answer any questions. You know, we're right outside of Orlando, so you can make a vacation out of it.
You know, there are a lot of patients that do that. They will make a medical vacation out of it. I hope that at some point patients won't have to travel to get this done, but in the meantime, you know, it's not that bad of a compromise to be like, well, might as well hit Disney while I'm getting my procedure done, because you feel fine after this. It's not like I have to go home and get in bed now.
Thank you so much for watching. You can help others tremendously by sharing this content. Never forget to educate yourself and be your own health advocate. Now, watch this next interview right here.